All right, welcome. I'm Dr. Sri Shamasundar, and I'm one of the co-founders of HEAL, and we wanted to give you a little introduction around HEAL and what we stand for and what the 2 years of the fellowship looks like. So we're going to get started. So HEAL stands for Health, Equity, Action, and Leadership. And we actually started our first class in 2015, and we ended having all the third class of fellows that came together in June and July. There was 35 of them from 8 countries around the world, and so for 2018 to 2020, we're recruiting our 4th class of HEAL fellows, and so our mission is really to train and transform frontline health professionals through building a community dedicated to serving the underserved as their lifelong choice. And I think this is such a key piece of HEAL, is bringing together a community of like-minded health professionals that are all dedicated to serving poor populations. And the diversity of fellows that come together from all over the world, whether they're from Malawi or Navajo Nation, indigenous communities in the United States, Central California, there's really this amazing diverse community, and that cohort really shapes your experience and immersion into global health in a way that I don't think any other fellowship out there can match. And the vision you can read here, but we believe that people coming together can transform systems, and through the process, we continue to be transformed. And these 2 years for Global Health HEAL Fellows, UCSF HEAL Fellows, is really transformative on a personal level, on a professional level, and really in working in solidarity in so many different communities, really transformative to the system. And that's our goal for HEAL. So some of our core principles is to commit to serving the underserved, learn from immersive experience of delivering care, and the work being our greatest teacher. I think coming into this 4th class, what we've really seen is people that are committed to being immersive, really taking on the role of being an adult learner, having this balance between action and reflection and engaging in serving very poor communities, and then going back and having conversations and thinking deeply and reflecting upon the work, and then going back and engaging in clinical work, in systems work, in scholarship. That's where our greatest teacher lives. Next is building a community of practice to reflect, act, and work together. So this is a key focus of HEAL, is the diversity of the cohort and the practice of serving poor populations, and the knowledge and the earned wisdom that comes from that, I think, is unmatched. And so for 2 years, being immersed in Navajo Nation or at one international site is really transformative, we believe. And so the goal is to transform ourselves, our community, and our patients to engaging with the personal, the social, and the systemic. And I think HEAL's approach is one that after 2 years, there's going to be both core competencies around clinical and non-clinical skills, but there's going to be really a deep wisdom that only comes from immersing yourself in this work. So we'll go through briefly the folks that are part of the leadership team of HEAL, and you can see myself. I've worked in Burundi and Rwanda and many places with Partners in Health. I had a Fulbright to India where I was focusing on understanding how organizations that serve tribal communities, what are their innovations of care, how do they deliver care, high quality care to very poor populations. And so there's a intensity and a seriousness in uh, being practitioners of this work, and that's really who our leadership team uh, is focused around. You have Joseph Scarpelli, who's HEAL's program director, has spent some time with Global Health Corps as well as in East Africa with the 1 Acre Fund. Next is Sangeeta. She's our strategy and operations director, and she's worked on multiple levels throughout West Africa and South Africa, spent over 15 years in Sub-Saharan Africa working on systems change, working from organizations very, very close to the field to being part of foundations like Johnson & Johnson and the Clinton Foundation. So a world of experience. Dr. Tittle is our curriculum director, who's worked closely with some serious experts in the field of both medical education and curriculum to shape the competencies that we want HEAL fellows to come away from their time with HEAL at the end of their fellowship. Really, we think of this work as a lifelong marathon, and HEAL is the beginning of that sprint. And so you'll get introduced to in-depth competencies, 6 competencies of global health that we think all fellows should start to get familiar with and begin to move towards competency around. Dr. Ethel Wu and Dr. Fukle were both instrumental in the Ebola response in Liberia with our partners Last Mile Health. Dr. Fukle is one of the co-founders of HEAL, has spent a lot of time, did his residency in global health equity at Harvard under the mentorship of Paul Farmer and Jim Kim. And he came out here to UCSF in 2011, and we developed the HEAL Fellowship together. So some of HEAL's values, the main values: community of practice, health equity, context-driven, equitable partnerships, humility, solidarity, and advocacy. So the idea of, we've talked a little bit about community of practice. The health equity is a major value of trying to develop and imagine a world where no one dies from diseases we know how to treat, and all populations have access to high quality healthcare. And that's really a driving force of why HEAL exists. And context driven, we have a number of partner sites around the world, and really our role as HEAL fellows is to walk that journey with our partner sites. And so the work in rural Mali might look quite different than the work in rural India, because our partners who are immersed in that context are shaping the needs of that context and of their patient population. So, for example, in rural India, our site, one of our sites is JSS, that is a highly medical education role with a family medicine residency in rural India, and a clinical role. And in rural Mali, it's really a systems role. And it's both in the urban parts of Mali as well as some of the rural areas. And it's really on a health system strengthening with the Ministry of Health. And so the context drives how a HEAL fellow works in specific contexts. Equitable partnerships, the walking this walk with all of our partner sites. The partner sites are picked specifically for their commitment to poor populations and their orientation to this work. And so we've vetted and also been in partnership with these organizations for quite some time. And really, it's a deep bond and solidarity to do this work well. And so we strive for equitable partnerships between UCSF HEAL and all of our partner organizations, both in Navajo Nation, in Salinas, in Central California, and internationally. I think you can't really talk about global health without talking about humility. The piece of coming in and working in places that are outside of your comfort zone, outside of a familiar context, the level of humility that we need to approach the work from. And actually, having fellows over the last several years, this is really one of these qualities that are non-negotiable in terms of people that really thrive in the HEAL Fellowship, coming in with a great degree of humility, a great degree of active listening, trying to understand the context and the suffering of a population before you're moved to jump to action. And so a lot of times people see a tremendous amount of suffering and they feel like the problems should be fixed. They could be fixed with a different approach. But most of our HEAL fellows that really thrive are paying close attention to folks that have been there for a lot longer than they have, and coming in with a great degree of humility in the work. So that's a huge piece of the ethos of HEAL. The next value is around solidarity and advocacy. And this piece of a physician, Virchow famously said that physicians are the natural attorneys of the poor. And that's exactly what HEAL strives to be, is that a physician is an advocate and should be an advocate. And how do you get stronger at being an advocate, being a witness, speaking out about things that are unjust and speaking about it eloquently, writing about it in a compelling way, and taking on an advocacy role as part and parcel as your role as a physician. So the next slide the context that HEAL, this Venn diagram of where we started, is trying to engage with unmet passion of American health professionals and having global health be much more than a geographic location, but really an orientation on serving the underserved. And for American health professionals, Fluke and I actually met in Haiti after the earthquake, and there was this huge groundswell of health professionals that came out to rural Haiti, but oftentimes they didn't understand the context, they didn't understand the history, and the will to do good was not matched with the expertise and the skill. And so we started HEAL with the idea that all these folks that really want to contribute as American health professionals really need to have the mentorship, the training, the support to do this work well. And so I think that's one of the core pieces of HEAL. Another thing that we found when we were thinking about starting something like HEAL, we would often talk to program directors in New York, and they would say, all these young residents want to go work in Haiti, and as they move from taking a Lyft or a taxi from Manhattan to Queens to fly out of JFK to go to Haiti, there's so many communities that they pass. There's so many places that need high quality healthcare and their commitment within the United States. And I trained in the county system in Los Angeles at Harbor UCLA, and that's absolutely true that domestically in the United States, there's such a deep need. And we started working in Navajo Nation because that is a place where within the United States that has an incredible need, and they have an incredible shortage of health professionals. And so our commitment to global health is really truly global, whether it's in the United States or internationally. The core fellowship elements, so immersive experiences, serving the underserved, the community of practice. I think that the cohort that you're a part of is unmatched anywhere in the world. This level of health professionals that are deeply immersed in work in Malawi and Haiti and Navajo Nation and Salinas, all being in the same place, discussing similar issues, different challenges, and getting that support both from a personal and professional side, and really walking that path with so many like-minded people is really an incredible opportunity, I think, of HEAL. And it's really the thing that energizes all of us every year, is to see the cohort that develops and are committed to these same values. And mentorship is another piece of HEAL. I think when I went and traveled to rural Burundi after residency, I spent several months in rural Burundi, and a lot of the mistakes I was making, a lot of the things that I didn't quite understand, I wished that there was somebody to bounce ideas off of, think about the work more deeply. And oftentimes, I had some person I could drop an email to here or there, but really no mentorship baked into the work. And so that's what we built HEAL with an eye towards, is to have mentorship, to have this community of practice that supports you as you try to take this global health training to the next level. The HEAL Global Health Training, all fellows get together the first 2 weeks of the fellowship, and there's training on management and leadership, ethics. There's training on structural competence. We discuss well-being. How do you stay sane as you work in these difficult contexts? And so I think that initial training is such an important part and really transformative to so many of the fellows. And you gather 2 more times during the course of your fellowship, once at the mid-fellowship retreat, and then again at graduation. So these 3 community events really shape and structure the fellowship. Professional development over the 24 months for rotating fellows that are applying now, there's a support to go to conferences, get additional training in specific areas that you're trying to grow in. So that, I think, is incredible. And the community of practice and the professional development, a lot of it has, after you have the community events at the beginning of your fellowship, there's an online portal that we've developed that continues the conversation and the community. And there's journal club, there's M&M across all these sites. And so really there's a lot of professional development that is ongoing. So I think the main program components, if move into the next slide, is this collaboration with peers, social medicine training. I think a lot of us that come into physician training don't understand how to take care of poor populations, don't understand deeply the social determinants of health, aren't immersed in this work day in, day out in a way that you really can't substitute for. I mean, you can't learn how to swim in a classroom, and you can't learn global health in a classroom, and that's very much a part of the ethos of HEAL. There's structured mentorship. There's calls twice a month between your mentors and yourself, along with the cohort. So we call them pod calls. So there's based on geographic region, there's like 4 to 6 people in a pod, and they discuss everything from specific issues that are going on at your sites and challenges, as well as well-being and journal club, all kinds of things that arise. And then another major benefit is UCSF salary and professional development support. And so being part of UCSF, I think, builds in a lot of legitimacy. We've had a lot of our fellows go on to take jobs where they're splitting their time between an academic center and internationally. They're doing, they're going to interviews in their second year of the fellowship, and they're getting a lot of interest from a lot of different places around the country, both because they've had this deep experiential learning, they've proven that they're committed to this work, and they have this this well-recognized name, UCSF, that really supports what they're doing, gives legitimacy to the global health training that the fellows are undertaking. So just to go through the model briefly, we have what's called rotating fellows and site fellows. The rotating fellows spend 6 months in a domestic site and 6 months in an international site. And that goes on for 2 years, back and forth, at the same domestic site and the same international site. And if you look on our website to apply, you can rank kind of the domestic sites that you're interested in and the international sites based on the job description and the best fit for what you're looking for. And so then when you're at a domestic site, there's also a site fellow that is selected from that partner site. And the same is true at the international partner site. There's also a site fellow that's selected there. So really, if I'm working in Shiprock in Navajo Nation, then say Dr. Fukley is working in rural Liberia with Last Mile Help, and we then switch, and Fook comes to Navajo Nation at Shiprock, and I go to rural Liberia. And so there's some continuity of the projects that they're working on together, the site fellows that we're interacting with. And so you have an ability to have kind of this warm handoff between both patient care and projects that provide some continuity to the partner sites, as well as allows you to learn from your counterparts. As I mentioned, the global health training, some of the curriculum, I think this is an absolutely phenomenal training that happens for the first 2 weeks of your fellowship. And really this is the program that I wish I had gone into and understood at the level that HEAL fellows are brought into. We have experts from UCSF. We have experts, from other disciplines that come in and talk about structural competency. We have this amazing anthropologists that teach about the social determinants of health, structural violence. We have a beautiful facilitator on power and privilege. And I won't go through every element in this training, but you can see Friday of week 1 is something called Introduction to Public Narrative, and there's this amazing educator called Marshall Gans that helped Obama shape his 2004 speech at the Democratic National Convention. And so that format of talking about the story of self, the story of us, and the story of now, I think is this beautiful narrative that all Global Health HEAL Fellows have to do, and it's a 5-minute presentation that talks about how you came into the work, how you think of the collective of all of us doing this work together, and the urgency that drives this work right now. And so, I think there's focus on the Stanford Teaching course, which is really about being a strong clinical educator, one of the best educators, in the country that is at UCSF, teaches that course. And so we're able to pull from some amazing people doing this work that are in the larger UCSF community, as well as people within our networks that are teaching these first 2 weeks. And as we mentioned, really, this is where you solidify your bonds with the HEAL Fellows from all over the country and all over Navajo Nation and all over the world. And so I think that this cohort is incredible, and it's an incredible resource for your entire life. It's an incredible resource for the time that you're a fellow, and it really transforms, I think, all of the fellows. That's been our experience. So you can see in the photos of the hands-on training, there's simulations, there's ICU simulations, there's ultrasound training. The pictures on the left, there's like a disaster response that is simulated that the fellows are responding to. So there's just a ton of really incredible, innovative curriculum that helps strengthen your skills to be an effective global health practitioner. So the core competencies, these are the 6 core competencies that we've landed on from deep reflection on the scholarship that exists in global health, as well as the knowledge of experts in medical education, as well as experts in global health. And so there's this beautiful nexus of understanding medical education and global health being under UCSF, as well as being tied to all these partner organizations that are immersed in taking care of poor populations. And so this development of these competencies, and then having a longitudinal curriculum around these competencies, I think is one of the incredible strengths of HEAL. So number 1 is adherence to principles of health equity and ethics. Number 2 is effective engagement with the local health system, advocacy for communities, health systems, and patients, provision of high quality care focused on the local burden of disease. I think that understanding, what the epidemiology is, what specific social, and economic challenges your population faces, and being able to deliver high quality care against that is so important. The demonstration of leadership and interprofessionalism, understanding that global health and medicine is a team sport, and really being able to work across professions, and having the leadership training to come into your own in terms of leading a team, in terms of facilitating and supporting other health professionals all over the world to strengthen their own advocacy and be a voice for them. And then the development of strong and diverse teaching skills. Our record of advocacy is quite impressive. We've had fellows that have published in the New York Times op-eds. We've had fellows that have written, on our blog, have been published in local journals within their country. So it's an impressive group of advocates and writers and thought leaders that we're aiming to shape HEAL fellows to become. And I think one note on being a rotating fellow, I think you're coming into HEAL at UCSF PGY4 salary, and you're really, if you went and worked in Navajo Nation on your own, I think we encourage that as well if that's the path that you want to take. But coming in as a HEAL fellow, you're also supporting health professionals and site fellows around the world and strengthening this community. So, I think that one of the main roles of being a HEAL fellow is being part of this community of like-minded health professionals, and knowing that your work and your commitment to this work also allows for building that community and building workforce capacity around the world. And so you're part of that conversation, you're part of that movement to, I'm an American health professional that wants to do this work, but, I am part of the story of health professionals from Malawi and Mali and Mexico that really need to have these opportunities like I have. And so that, I think, is a big part of the ethos of HEAL, and coming in as a rotating fellow, that's part of the conversation that you're a part of. And I think that is, really a beautiful part of HEAL. So our partner sites, domestically, we're in several sites in Navajo Nation, both in Arizona and New Mexico, as well as Salinas, which is in Central California, working with migrant farm workers. In Navajo Nation, we work in Shiprock, we work in Chinle, we work in Gallup, we work in Tuba City and Fort Defiance. And internationally, you can see on the map, there's sites in Haiti, in Mexico, in Mali, Malawi, Liberia, India. We have 3 sites in India, as well as in rural Nepal. And so on the website, you can see the specific sites that we're recruiting for this year, because every year the needs of our partners and the needs that we need to fill changes. But these are our partner sites that we're committed to in the long term. So I think an important part for us at HEAL is to make sure that HEAL is the right fit for people, because you're signing up for 2 years of your life. You're committing your energy, your enthusiasm, your skill set, and it's a really important transformative experience. The potential for deep transformation of yourself, of communities, of systems is profound, but it's also a responsibility that requires diligence on your side as well as our side, because the people that thrive as HEAL fellows often want to be part of a transnational and interprofessional movement for health equity, deeply rooted in the experience of local organizations, communities, and patients. And so you're coming into this community with that real deep commitment to serve. And as an American physician, you want an opportunity to support and advance health professionals from underserved communities. You want your own transformation to occur, but you also want to walk that journey with multiple others. And so I think that's an opportunity to be part of a community of diverse health professionals, and then you're also getting exposed to diverse mentors and organizations doing incredible global health work. And so you'll be part of a community where you see the inner workings of incredible partner organizations with incredible leadership, incredibly committed spectrum of health professionals. And so I think that's this, you're not only exposed to great individual mentors, incredible peers, and then incredible partner sites as well. And so I think being part of all of that is really both a incredible privilege or responsibility and a chance to build up yourself and build up the movement for global health equity. So the qualifications for physician applicants: strong commitment to social justice and health equity, being a U.S. citizen or permanent resident. I think HEAL is committed to have everybody be a part of HEAL as much as possible, but the restrictions on the rotating fellows are at the national, U.S. government level that we really we can't change at this moment. So being a U.S. citizen or permanent resident, completed or will be are in their final year of residency at a U.S.-based institution and are licensed to practice medicine in the United States. These are the categories, the specialties that we're recruiting for this cycle. So internal medicine, family medicine, med peds, pediatrics, psychiatry, OBGYN, anesthesiology, and general surgery. And especially, I think we're looking for health professionals that are the first of your generation to go to medical school. Underrepresented minorities are especially encouraged to apply. And the benefits, we touched on this before, but it's a PGY fellow for salary. So if you had done a cardiology fellowship at UCSF, it's the same salary that a cardiology fellow gets paid. It's standardized across UCSF. 100% benefits, UCSF fellow benefits, malpractice insurance, evacuation insurance, international housing and support, travel costs are covered, access to UCSF library resources. And I think that with this package of benefits, really your ability to save money, and have with the PGY4 salary and living in some of the communities that where the expenses are really much lower and your housing and your flights are covered, the UCSF salary goes a long way in allowing you to put money aside for loan repayment or other costs or savings. So the application process, you can see here, visit the HEAL website, start an application, include 3 references. You don't need letters up front, just references. Draft a brief personal statement telling us why you're passionate about global health equity, and submit an application. The deadline is coming up. It's October 1st. If you have any questions, you can email us at info@healinitiative.org. So, I'll end with saying, we're so excited to have you be interested in applying to be a HEAL Fellow, and really it's an incredible opportunity to get connected to now. There's 90 health professionals from 8 countries that have either were recently HEAL Fellows or are currently HEAL Fellows. And this class of 2018 to 2020, we're looking for, incredibly gifted, incredibly committed people that can take this movement of global health equity forward. And so, please email us or check out our website, and we look forward to seeing your application. Thank you.